this is the end of his second visit, and we have achieved normal mobility, normal spring mobility of the fibula on the right, and normal posterior glide spring mobility of the lateral malleolus, and normal anterior spring of the fibular head. We also corrected the right anterior ilium, and so this now springs posteriorly. Now earlier he felt when he was walking that he would scuff his heel. And he also noted that if he walked with his feet pointed straight ahead, that reproduced some pain down here in the lateral lower leg. And that's no longer present. The other thing he presented with, if you could line your stomach, was blocked mobility of the sit bones, the ischium, on both sides. And that now has spring mobility. The right side has spring mobility. Also has medial mobility on the right, and also has lateral mobility on the left. Positionally, he still has asymmetry. So that is developmental. So we're not going to significantly improve the positioning. Okay, I can't tell that it's changed at all, but I can tell that the mobility has improved. I did not have to treat the coccyx directly. By restoring the mobility in the lower pelvis, then this corrected. Okay, let's have you lie on your back. The other thing we treated was he had no mobility in springing the AC joints, and now we have much improved mobility on both sides. He had a complex pattern involving his SC joint that we didn't find on the first day, and a complex pattern of the first rib, which was stuck inferiorly, and that was not found on the first day. But we treated those today, and that's much improved. And we did on the first day find lack of superior spring of his first rib on the left, and now he has very good superior spring. Okay? His upper cervical was very tight. In neutral, he had no spring mobility, and if you point the camera to his feet, you can see that movement translates to his whole body now. And if I put his head in extension, that springs nicely. And of course it also springs in flexion. Okay, so that's much improved. And can you reiterate how you feel in response to yesterday's treatment?
Well, my arm, I can move my arm now without the tingling.
Uh-huh.
It doesn't, I can do that now. I couldn't do that before.
Uh-huh.
And that basically solved that problem.
Uh-huh.
And my hip seems to be, I don't think I scuff my feet anymore.
Uh-huh.
My heel, and that's better.
Okay, and less lower leg pain when you walk?
Yes.
Good. And then you noticed, interestingly, that today you said your feet were pointing straight up.
Yes, if you notice, they're like more this way.
Yeah.
Normally I walk like a duck this
Uh-huh.
way.
And so they were straighter today.
Yes.
And that was a spontaneous phenomenon. I don't know what improved that positioning of the hips, but I'll take it. So, interesting case. I thank you for letting us film you.
You're welcome.